the midst of Maine's deadliest shooting, a group of doctors and nurses were in a race against time.
That fight was happening just 2 miles from where the shootings happened at Central Maine Medical Center in Lewiston. News Center Maine's Alex Haskell checked in to see how hospital staff are this year.
The community, the physicians, that really drew me into joining here first as my first real job out of training.
Dr. Erway Tang has worked here for 16 years. He oversees the intensive care unit at Central Maine Medical Center.
So I was at home and I was reading a book with my youngest daughter.
On the night of October 25th, his phone started going off. Text messages from colleagues about a possible shooting.
The news of the mass shooting spread throughout the entire system very quickly, and there was a significant outpouring of everyone wanting to rush in and help.
The hospital quickly assembled a large team of surgeons, backed up by more than 100 nurses and other healthcare professionals. Over the next 42 minutes, 14 severely injured victims arrived at this trauma center. By the next morning, with a shooter on the loose, Central Maine Med was surrounded by armed guards.
I do recall, a lot of people just with their head down and in disbelief. I saw sobbing family members. I saw an incredible group of trauma surgeons.
Following surgery, survivors moved to the intensive care unit, where Tang and his team helped them begin the long journey to recovery. As Tang explains, it's his job to wake up patients, tell them for the first time where they are and what happened.
They had a sense of hopelessness. They don't want to get up. It's too painful. They're too tired. Some patients, which is very sad, were too scared to leave the ICU, even the ICU room, asking us, is there a shooter?
During this time, he and his colleagues were provided counseling, as hospital leaders realized this will be a long and emotional experience for staff too.
A lot of them really were impacted by the struggles of our patients and families. We developed this closeness that we don't normally develop with our patients. Some patients stayed for multiple months.
As survivors healed enough to go home, hospital staff gave them special send-offs, lining the hallways. Some victims receiving thunderous applause and cheers, others opting for a gentle clap. Of course, Dr. Tang was there.
We saw family members with kids, and seeing their kids run up to them gives our team continued hope and joy in doing the job that we do.
A year later, the weight of it is still heavy.
I'm doing better. I have been in touch with leaders of other ICUs who have gone through the same thing.
A chance to share experiences and feel heard. Tang says he knows colleagues are still struggling with all of this.
People don't need to say anything for us to know what they're thinking, where they are.
The whole hospital medical team has grown closer to one another. In Lewiston, Alex Haskell, News Center, Maine.